So you do a lot of cosmetic dentistry
Yes.
in your practice. You
Yes.
teach cosmetic dentistry, I guess, at the Las Vegas Institute.
Right. I teach it there. I've lectured to dentists across the nation about the type of procedures that we do every day in my practice.
So with porcelain veneers, take me through the process. And I always wondered, like, how do you let them know what it's going to look like at the end?
Yeah.
Like, take me through that whole thing.
I think one of the strong suits that I have is I've done so much of this through the years that I'm very comfortable in seeing whatever your situation may be and picturing what it could be. So I spend a lot of time with our patients in finding out what they want, what they don't like, what they do like. We talk about shape and color and arrangements and things, and we use pictures of cases I've done previously. We have some forms that show the teeth in different arrangements, but all the while I'm taking copious notes on what we want this smile to be and how I want the end result to be before I've even ever done it. So that first initial appointment is really, we're just gathering information. Appointment number 2, they come in and we do the actual work on the teeth. So we have to do some shaping, some whatever, we take impressions. And then at that point, we're going to have temporaries that are made to the notes that I have given my lab guy to give us what we call a trial smile. So
is that right? Okay.
The trial smile is a way to test out what we thought was going to work, and now is it actually working in your mouth. So once the temporary is on, we give the patient a mirror and they get to look at it. Most of them think, "Where are you done? Did this just, I thought these were temporaries," because they can look that good.
Okay.
But it's a critique time. They get to say, you know, maybe we should round this corner over here, or I might want to make some changes myself, but it's usually very small because we've spent so much time getting to this point. But we can make changes if we need to. At that time, they're going to have the temporaries on a week to 2 weeks, depending upon what their timing needs to be. They come back for appointment number 3. We take the temporaries off and we place the veneers on the teeth, not glued in, but just place it on. Once again, they get the mirror. This is a critical point in the process to give the patient comfort, because now they can say, "Well, I don't like this," or "I do like this," but they're never stuck.
Do they usually say, "I like it"?
It always happens that way.
Okay.
I've rarely had to, over my career, had to send anything back at this point. But the patient likes feeling that it's a checkpoint where they're not stuck with something they don't like.
Nice.
They don't have to get up and walk out the door and go to the car and look and like, what happened? That's not the case. So yes, we don't send things back, but it gives them a feeling of comfort to know that they can have some control in the process. So that's it. I mean, it's basically 3 appointments.
And they don't stain? I mean, veneers don't really stain, red wine, things like that?
The color that they go in day 1 is the color they are 10 years later. Now, you have to take care of them. You have to brush, floss, see your hygienist, do all the normal things. But staining, not an issue. You don't have to whiten your veneers. You don't have to do any special maintenance beyond just what we talked about.
Now, you teach this to dentists all over the world.
That's right.
As we mentioned at the Las Vegas Institute. And we've had this conversation off camera in the green room that the second part of veneers and cosmetic dentistry is you got to get the bite right.
Yeah.
And this is like your wheelhouse or your specialty.
Yeah, you know, things can look pretty, but they got to function at the same time. They have to work. You have to be able for them to last. Absolutely. You know, I'll use my own mouth. I've got veneers that I've had in for 23 years. They're in perfectly good shape. Now I'm doing some other things with my braces.
Orthodontics on, things like that?
I'm doing some other things in my mouth right now, but I've had veneers 23 years, not a thing wrong with them.
Okay.
So when they're done properly by someone who knows what they're doing, they can last for years and years.